Good afternoon, everybody. Good afternoon, ladies and gentlemen.
Good afternoon, sir.
Good afternoon. My name is Dr. Olayinka Shunevon. I'm the chairman of Ophthalmological Society of Nigeria, Lagos branch, and I want to welcome each and every one of you to this webinar, which is organized as part of our activities to mark the World Glaucoma Week, which is an annual event that is held every second week in March, to draw attention to the menace of glaucoma, which is an irreversible cause of blindness and also the need for early detection and treatment. The theme for this year's Glaucoma Week is Uniting for a Glaucoma-Free World. And it's in line with this that we've organized this webinar. And today, the moderator for this webinar is no other person than Professor Adeola Onokoya. She's a professor of ophthalmology at the Lagos State University College of University Teaching Hospital in Idiaraba. She is the head of glaucoma unit at the Department of Ophthalmology, Guinness Eye Center in Louth. She was the past chairman of the Faculty of Ophthalmology, National Postgraduate Medical College of Nigeria. It's at this junction that I would like to transfer the proceedings to our dear professor. Professor Onokoya, over to you.
Yes, thank you very much, Yinka. Dr. Alabi, please take over the admission of people onto the platform. Good afternoon, everyone. I want to welcome everyone also once again to the World Glaucoma Week, and I say happy World Glaucoma Week to everyone. You know, in Nigeria, there is happy this, happy that for everything. So happy World Glaucoma Week. The essential thing about Glaucoma Week is raising awareness on the enigmatic disease called glaucoma. It's really an enigma because nobody really understands that disease. And that's why we are doing this afternoon. This is going on all over the world and is for the rest of this week till Saturday. We'll have World Glaucoma Week being celebrated all over the world. And this year, the theme for the World Glaucoma Week is Uniting for a Glaucoma-Free World. Everybody has a role. Everybody has a role in the unity for a glaucoma-free world. I'll start off by telling us what glaucoma is. And then from there, we have 3 cases to present, but I call this a real-world case presentation, meaning we have the real patients doing the case presentation themselves. These are actually members of the Glaucoma Patient Care Initiative in Nigeria. These are people suffering from people who living with glaucoma, and they will tell us their stories, and we can then relate with it. So I start off, the first thing is to say I have nothing to disclose with regards to this presentation. So what is glaucoma? Well, glaucoma is a group of eye disease with characteristic damage to the optic nerve, which is the nerve of vision. And this nerve of vision is actually like a cable. That is what I'm pointing to. This is a model eyeball that has been slit into 2 so that we can see the inside of it. Now, for us to be able to see, the visual processing involves the contact of the rays of light or the image with this part of the eye, which is called the cornea, which is transparent. And the rays of light pass through it and they get converged on a membrane-like structure called the retina. And it is inside that retina, we have all these cells that are processing image in the eyes. Now, that cell that processes the image is called the retinal ganglion cell. And it has a cell body on that retina, and then the arms of it are what come together to form the optic nerve, you know, like fronds coming from the cells. They form this nerve, which is like a cable. And this is what then transmits whatever image that has been processed in the eye to the brain. This represents the brain. And it is in the brain that the final image processing takes place. And then we'll have interpretation and perception of vision. Now you can imagine a disease that then damages this retinal ganglion cell on the retina, or even damage these fronds called the optic nerve, which is like a cable. So it's like you have this ball, and then you have this cable transmitting electrical signal to the brain. But when this cable is damaged, that is what happens in glaucoma, and it is characteristic to glaucoma alone, the type of damage that you have. You then ask me, what causes this damage? Well, we really do not know why people who have glaucoma, why they have it. However, we know that the pressure inside the eye, this pressure actually is generated by a fluid, which is an extract of the blood. Now, what this fluid does is to provide nourishment for all the structures that we have in the eyes so that our eyes can function perfectly. Now, when that fluid is used up, then it drains through the space here. And in some people, that space, there is an impedance to the flow of the fluid out of the eye. Is either some degree of resistance, or the fluid is not even getting there, depending on the type of glaucoma the patient has. What then happens is, in such individual, that fluid begins to accumulate. And when it accumulates, what you then have is a back pressure effect, which then begins to damage those cells. Remember, the retinal ganglion cells that are on the retina. And you can imagine, image processing is taking place in there, but now you have a pressure on those cells. Of course, it's going to snuff the life out of those cells. And when those cells are dead, of course, even the eye looks normal. It is not processing imaging, and nothing is being sent to the brain. Or in some instances, that pressure actually is exerted on the optic nerve, which is what we are looking at here. Now, this is just to show the effect of the pressure on those tiny, tiny cells, which are also shown here. Now, when as ophthalmologists, we look inside the eye, this is our focus of attention in trying to diagnose glaucoma. Now, this pink area is the normal nerve fibers. This is what is referred to as the optic nerve head. And you can see that there's a small whitening at the center, which is referred to as the cup. Now, that cup is an empty space, but you have the nerves all over here. Now, compare it to this individual who has glaucoma. You would notice that there's an enlargement of the white area, meaning there's an emptiness here, which we call cupping of the optic nerve head, because there's now a wider hole, because those nerve fibers are already damaged. And this is what we see in patients who have glaucoma. And such patients, you can imagine. So looking at this one, then you know that this is a patient who has very severe glaucomas. Now, those nerve fibers, those tiny, tiny fronds, about 1.2 million of them is what we have constituting the optic nerve head here. Here, we have about 1.2 million of them. And the moment we begin to have damage, the numbers begin to decrease. Now, each of those nerve fibers subserve a point in space for you to be able to see. Now, by the time you have lost maybe about 400,000, you may still not know, because it tends to affect the periphery, which we usually do not take cognizance of. But by the time you have lost almost 98%, that is when it begins to dawn on that individual that I cannot see far very well. And this is what is typified here. This is what is called the visual field. It's one of those tests that we order when we make a diagnosis of glaucoma. You would notice this is plain, so this is very early glaucoma. But notice this dark area. This represents that area of enlargement superiorly here, because it's the opposite of the field. The lower part of your eye is what subserves the upper part of the field. So also here, notice there's an enlargement or extension superiorly and inferiorly, which is why you have that darkening above here and below. Now look at this individual. This eye, everything is almost gone. So you have everywhere dark. And this is what is called the scan, OCT, we call it optical coherence tomography. You would notice that there's redness everywhere. It means that those cells are no longer sensitive, majority of them dead. And the thing about dead nerve cells is once they die, there is nothing you can do to them. And patients who have all these black spots, this patient is virtually blind, technically. And the blindness in glaucoma is not reversible, unfortunately. So glaucoma, I say, is a disease that is not well understood. If you remember, I said we don't know the cause of glaucoma. And if you don't know the cause of a disease, then it means you won't even know what to do to cure it. So there's no cure for glaucoma as we speak. But what we are only doing is to prevent a patient from going from this early stage, early disease, to this very late stage where patient has lost almost all the nerve fibers. So the cure is not yet found, and it progresses despite intervention. Now you can imagine somebody who does not know. The rate of progression of the disease is faster in them. And that is because once you have a nerve fiber that is dead, it begins to degenerate. And that process of degeneration liberates a lot of toxic substances. And this will now impact on the healthy nerve fibers that you have. So you then have a vicious cycle. So the nerve fibers will continue to degenerate. So that is why it is a progressive disease and is the commonest cause of irreversible blindness worldwide and in Nigeria. Now, a patient who has glaucoma, typically, how do they present? A patient with glaucoma usually is asymptomatic until the very advanced stage. You then ask me, how will I know if I have glaucoma? Because it is painless. Now, there are two types really. You have the open angle and the closed angle. The majority of glaucomas we have is the open angle. You know, it's just some resistance because of some deposition. Now, those who have the closed angle, the very acute type, which is minute, maybe about 5 or 10% of them, those are the ones that may have very severe pain. But in this environment, in Nigeria, in Africa, largely we have the open angle. Now, this child was born with glaucoma. Typically, glaucoma in children, you will see such a baby with very big eyeballs. These are babies that in the first month of birth, the baby will not open the eyes. The eyes will begin to water anytime you put on the light. The baby will not open the eyes. If you see such a thing, or very big eyeballs as we see here, this is not because the father has very big eyeballs. This child has glaucoma. So this is to let us know that children also suffer from glaucoma. Even young adults, they suffer from glaucoma, the one that is called juvenile open angle glaucoma. You will only know if your child has it if you take your child for eye examination. And that is why we also lay a lot of emphasis on school eye health program, so that children should be examined at the age of 3 and when they enter primary school and when they get into secondary school. So please always remember to take your children, particularly those who have family members who have glaucoma, or somebody has gone blind in the family and you don't know why. And like I said, it's naturally a progressive disease despite treatment. So you can imagine somebody who does not even know and is not even being treated. Such an individual can go blind within a period of 10 years. And the reason is because the central acuity, what you see in front of you, is maintained until the very late stage, when all that you have left is maybe only 2% of the nerves. And that is why a lot of people tend to present late. Now, this is what a patient who has glaucoma sees. This is the normal one. Now, at the very, very early stage of glaucoma, you notice that colors begin to fade out. You know, the contrast is very low in them. And it then goes on to this, it goes on to that, and it gets to a stage that the individual cannot differentiate the stop from the red background color until here, when that person cannot see. This is very advanced. Now, also, there's what is called visual crowding. This is a street scene on the road. Now, a driver who has glaucoma, for instance, who is fixated looking at that target in front, will be able to see this child on the right very well. But because there are so many activities going on here, may not notice this boy that is coming from the left side. It even happens to people who have normal vision. But a patient who has glaucoma, that visual crowding is accentuated such that they will not see such a child. And if that child crosses the road, it is possible that the child will be hit by that driver. Now, other ways also is they begin to have missing spots in the field of view. But if this is a bit higher up, that individual may not know because the center of focus is here. So he or she would say, I can still read very well, I can still see far very well, and would not know that he or she has glaucoma. And it then goes on to this. The individual is still focused on that traffic light, which he or she can see very well, but the surrounding environment or the environment is blurry. These are people that begin to bump into things until this very late stage that the only thing the individual sees is that point that is right in front of him, things that are to the side. Even if he's walking through a door, he can bump into the handle of the door or even the door itself. That is the very late stage. And that is what we want to prevent. And that is why we are doing a lot of this. Now, that pressure in the eye actually is the only thing we have now that we can hold on to. And that is what is being treated. And that is what has been proven for now to help in reducing the rate of progression or to even prevent those who have very high pressure from going on to develop the frank disease, which is glaucoma. So in treating patients who have glaucoma, what we are doing essentially is to bring down that pressure for now, because we don't know all those other things. Yes, we know that it may be that you inherited this, which means some genetic mutation has taken place, or it may also be because of the other condition that the individual is suffering from. Remember, I said those nerves that are scattered, those cells on the inside of the eye, if there isn't enough blood flowing to it, apart from the pressure effect of that fluid, inadequate blood flow can also cause problem. You can imagine if blood is not flowing well to your hand, of course, that hand, it only takes a matter of days. The hand will die off, it becomes black, and the next thing is it will just come off. So that also happens in glaucoma. If blood is not enough, maybe because that individual has very low blood pressure or extremely high blood pressure, all these would affect blood flow. Or the individual is suffering from diabetes, which affects blood flow as well, or other conditions that affects the health of those cells on the retina. All this would help in or would predispose that individual to glaucoma. So what we do essentially reduce the pressure medically by giving eye drops, or we can use laser, or we can even just do surgery for the individual. The surgery aims at in another hole so that the fluid can drain out through that hole. These are the various eye drops that we use. Occasionally, we may use tablets to bring down the pressure, and this is laser. This is a patient that was being treated with laser. In laser surgery, the eye is not open. The patient comes to the clinic and, we do the laser and the pressure will come down. And also, this is surgery for glaucoma that is being done. You will find out that majority of our patients are on medical therapy, with only about 15% taking up laser and only 10%. A lot of people tend to run from surgery in glaucoma. What they tell you is, my brother had surgery and he went blind, which is why a lot of people also run from the hospital when they are told you have glaucoma and it's better for you to do surgery, because majority do not even have the funds to procure the eye drops. The eye drops, I tell you, averagely, a glaucoma patient is on 2 or 3 eye drops. And in the present day, you would spend about 30K or 40,000 to buy this medication. And you can imagine, to comply with that may be a bit challenging in this season that we are in Nigeria. Which is why we are saying, look, come for surgery. But people are so afraid of surgery such that they run away, and by the time they come back, they have lost useful vision, which is not reversible. But how big is this burden of glaucoma? How many people are actually suffering from glaucoma? Worldwide, currently about 80 million, and by 2040, it will rise to 111.8. Now, worldwide, 1 in 30 people above 40 years suffer from glaucoma, and 1 in 10 of these people is blind in both eyes from glaucoma. And we also know that 1 in 10 of the people that are being treated will go blind in both eyes is despite adequate treatment, and 1 in 3 will lose vision in one eye despite adequate control. So you see why I said it's an enigmatic disease. Nobody really knows this glaucoma very well. And in Nigeria, over 2 million people above 40 years suffer from glaucoma, with a ratio of, if you have 40 years old, put 20 of them or 15 of them down, you'll find 1 person who suffers from glaucoma. And of these 20 people, 1 out of 5 is blind in both eyes. 1 out of 5 of 20 glaucoma patients is blind in both eyes. Meaning in Nigeria, we have averagely or even more of 400,000 adults above 40 blind in both eyes from glaucoma. And 1 in 2 would have blindness in one eye. 2 patients who have glaucoma, 1 of them would have blindness in one eye. In fact, 1 in 2 of glaucoma patients present in the clinic with blindness in one eye. And of course, about 1 in 3 of them, have family members who have glaucoma. So you see that it is quite a disease that we need to do a lot at. And you'll be asking yourself, am I really at risk of this disease? Well, all of us on this platform, because we are all Nigerians, we are African. African descent is an absolute risk factor, particularly if you're dark-skinned, and we all pray to grow old. Age is a very strong risk factor because our cells are getting depleted. Those cells on the retina inside the eye, they get old and they die off. And this also, predisposes us to develop glaucoma. In fact, if you're looking at the number of people who have glaucoma, as the age increases, maybe 1% at age 40, by the time it gets to 60, it comes to about 10%. By the time it gets to 80, it's about 20% of the population that suffers from glaucoma. And those who have family history, they have a 4-fold risk. In fact, in African, they are about 15 to 20-fold risk of you developing glaucoma. Particularly if your parents have glaucoma, the risk is very high. And then if the pressure in the eye is high, you also at a higher risk. And also depending on the makeup of your eyeball, some people have eyes that are predisposed, like people who are short-sighted, or people who have hypertension, low blood pressure, or if you are not taking your blood pressure medication at the right time, particularly those who take it at night time, it could be injurious to your eyes. So it's always better to ask your cardiologist what time is the best time for you to take your blood pressure medication. Don't just be swallowing it at night. And people suffering from diabetes and other disorders, all this can predispose one to glaucoma and migraine, and those who use steroid eye drop or even steroid, corticosteroid, prednisolone, such things, if you take it or if you are taking a tablet, you're at a risk of developing glaucoma, or if you've had an injury, and people who are highly short-sighted. What about in Nigeria? Of course, advancing age is a risk factor for us in Nigeria. High pressure, Igbo ethnic group. We don't know why we are still working on it, why it is so rampant amongst the Igbo. And Yorubas as well. Igbos first, then Yoruba, and people who have severe hypertension, illiterates, of course, because they don't know, and male gender, men, and people with very low blood flow in their eyes. What about the blindness? Who are the people who go blind from glaucoma in Nigeria? Igbo tops the list, Igbo ethnicity, and men, and those who are deprived. So it means that an Igbo man who is elderly and does not have money is likely to go blind from glaucoma. That is the interpretation. So we have to, anytime you come across an Igbo man who is elderly, who has eye problem, you have to be very aggressive. Otherwise, that individual may go blind. And these are the other risk factors for Nigeria. Now, the other anecdotal, obesity, overweight also could tip one over. Smoking is not good for you at all. You know, even your body generally, it predisposes one to cataract, to glaucoma, to thyroid eye disease, and other disorders. Alcohol, too, is not good for you. Stress. Oh, what can we do about this stress? Well, we have to try and reduce the stress. Otherwise, it can enhance or it can make glaucoma worse. And anxiety and stress, they work hand in hand. They are not good for you, makes blood pressure worse, makes so your glaucoma worse. So I'm going to pause here now, and we'll go to our real-world case presentations. Now, these are 3 patients who are living with glaucoma, and they're going to tell us their stories, 10 minutes each. You know, they've had interventions. For those who have not had intervention, we will hear them out. Remember, I said treatment is medical, laser, and surgery. So we go over to our patient. So I then step down. First will be Alaja Falilat Otule. Please, can you unmute yourself and tell us?
Good afternoon, everybody. My name is Falilat Otule. I'm a glaucoma patient. My father had glaucoma over the years, and eventually, are you hearing me?
Yes, we can hear you,
yes,
ma'am.
We are hearing.
My father had glaucoma. Unfortunately, then there weren't any awareness. He didn't know it was glaucoma he had. But later he got to know, and he warned us that we should all go to examine our sites. One day I was at Lut and I sighted the Guinness Eye Clinic. I quickly ran in there, registered myself, and started seeing my doctor. I underwent a series of tests, and it was finally decided that I need surgery. And both eyes were operated same day, and thank God they were all successful. 27 years back, I've been managing my glaucoma with the help of God and attending my regular clinic, using my eye drops. I've been managing my glaucoma. Sometimes I feel the blurriness of the eyes, and sometimes it's okay. I can read. I can manage it. Before I used to drive, but now I don't. Now this time, I manage it, and sometimes I feel, I manage with my pressure, because I always go for my clinic regularly. Thank God for that. It's nice that I thank God that I discovered the Guinness Eye Clinic on time, and I quickly went in for my surgery, and we thank God. I attend my clinic and manage it successfully. Thank you so much. Hello? Hello?
Thank you.
Go on to, yes, thank you, ma. So we go on to Alaja Akala. Alaja Akala, ma, it's time. Tell us your story.
Good afternoon, everybody. Or is it evening?
Evening.
I am Alaja.
Speak up, ma. We can hear you.
Okay.
We can hear you.
Okay. It was discovered that I have glaucoma and cataract at the same time. That was 1994. So, but I was told that it's not ripe for operation, and they've been managing it. Then I started at Ikeja General Hospital. From there, I started coming to Lut.
So
That was
3 years
19.
and you left home. Didn't want you to go.
I started Lut 1920. 2002. So since then, I've been going for my clinic, and after some time, that was 2022, I was asked to come for operation, which was done in December. And then that's about 2 years ago. And it was a successful one. Since then, I've been seeing well, reading, and I've been attending my clinic, using my drugs. And since I discovered I have it, I decided to take my children too, and my grandchildren to the clinic. And up to date, I still know they still attend clinic for checkup, maybe once a year. I take them for checkup. Even about 4 weeks ago, some of them still have to go for checkups. And since then, I've been using my Zalatan, because it's only one eye. The left eye was operated. The other one is not ripe for operation. So I'm still managing that, and I can still see well with it. So I don't have much to say, because we are enjoying the treatment and the awareness we take to the rules and regulations given to us by the doctors. So
Yes.
that's all I have.
Okay, ma. Thank you very much, ma. So we now go on to the third patient. The third case, Fumi Damola. Fumi, it's your turn. Tell us your story. Fumi, unmute yourself. Okay, maybe I should look for you to unmute you.
Now,
Okay. So speak.
good afternoon, ma.
Good afternoon.
Can you hear me?
Please, if you have questions for any of the patients, you can
Okay,
write.
standing on the existing protocol.
Okay, thank you, Fumi.
Standing on the existing protocol. I'm very happy to be in this program today, because this year make it 10 good years that I'm able to connect to this World Glaucoma Week. It was 10 years ago.
Go on, madam.
It was 10 years ago, exactly 10 years this month, that I'm fortunate to meet my professor on a occasion like this, celebrating World Glaucoma Week. In my own case, my own glaucoma was detected at very late stage. When I was diagnosed that this is a glaucoma, I said, no, God forbid bad thing, because I've never heard about it before. And, you know, unfortunately for me, I'm the 8th child in the family, whereby my mother and my father were still
We
seeing
can't
clear.
hear Mrs. Damola.
Okay, speak up. They said they can't hear you. Fumi, speak up.
Hello, can you hear me now? I'm speaking up. Good afternoon, ma. Can you hear me now?
I can hear her. Is there anybody else who cannot hear her? I can hear her clearly. Please, can somebody else confirm if you can hear her?
Good afternoon.
Good afternoon.
We cannot hear her. We cannot hear her.
We cannot hear.
You can't hear her.
We
can't.
I can't hear it too from my hand.
Okay. Thank you very much. We'll tell her to adjust. Thank you. Okay, Fumi, maybe to increase the volume of your device.
Hello, good afternoon. Can you hear me?
Your network is poor. Your network is
Very,
poor.
very,
Mark,
very
can
good.
you hear
Network.
me?
Your network is
Okay.
poor.
Hello.
So maybe to use a stronger one. Your network.
Because we heard her when she started and then she faded off.
Okay. So continue, Fumi. Anyway, she still has time. She will use the time for Alaja, the two Alajas. I think she's dropped off. Let's just wait. She will reconnect. She has dropped off.
Hello, can you hear me now, Dr. Alabi?
Yes.
I'm online.
We
Yes.
can hear you now.
Hello.
Okay.
We
So
can hear you now.
You can hear me
okay.
now clearly. Okay.
Okay. So start
Good
from.
afternoon, house.
Yeah. Thank you. Start again. Some people probably didn't hear
Okay.
you.
Okay. Standing on the existing protocol, I'm Damola Fumilola Dockers. I'm glad to be here today because this day marks exactly 10 years. It was a glaucoma celebration like this, World Glaucoma Week, in 2015. My professor and Alaja that spoke before went on Radio Lagos to do awareness about glaucoma. But in my own case, my own glaucoma was detected late, very, very late. When I first heard about it, glaucoma as a disease, it has no symptoms. When you started notice the symptoms, it has already claimed the vision of the eye. So when I heard about it, that it was glaucoma affecting my eye, I said, go for a bad thing. Unfortunately, I'm the 8th child in the family, even the last born, clearly. And all my happened to them. So it was so difficult for me to believe that it is glaucoma affecting my eye. When I first got to the first hospital that I went to, they just told me you had a glaucoma and starting using your medication, they prescribed almost 4 drugs for me. Despite the fact that the economy of Nigeria has not even added to this extent, but yet I found it difficult to meet up with the medication bill. I was faithful for some years, and when I noticed there was no change in my vision, whereby I'm buying drugs worth to 30,000 per month, and whenever I appear in the clinic, the doctor will just tell me, go then. The vision navigational vision. Then I always see lights when the only.
Yeah, I think she's dropped off again. She will come on. I think it's the area where she's speaking from, the network is poor. Fumi, are you back on?
Network, yeah, network is
It's a network, yeah. She will come back on. She's not.
I'm back already.
Okay, so continue.
Hello.
Yes, we can hear you well now. I wonder why it's just goes off.
When I don't know. So it was exactly, you know, when I stopped using my medication because I'm on this, the vision began to deteriorate gradually. So you get it. So by the time, you know, I don't use the drugs anymore. I could not see. When I met my professor, it was exactly 10 years today. She did all what she could, doing laser treatment and all that. But, you know, unfortunately, the vision has already gone. So, you know, as a mother, she asked of my age, and I told her then that I was 30 years of age. She encouraged me that you're too young to be a liability for your family, for your children, for your husband. You know, you need to pick up something doing. And she encouraged me to go back to a rehabilitation center, which I was enrolled in a blind school. You know, she encouraged me to accept my disability. You know, acceptability is the first thing, to accept that this thing has gone and it has gone. And you know, medically it's irreversible. Every vision loss to glaucoma is irreversible. And you know, after I was enrolled, I was trained how to mobility, then how to operate computer, how to do this and that. And fortunately for me, I was employed by Lagos State. Presently, I'm working with Lagos State at the local government. And you know, though what I want to encourage people is follow your medication. That is number one. Don't say it's expensive, because let me tell you the truth. Blindness is much more expensive than your medication. Use it regularly as instructed by your doctors. Stopping the medication, that is what caused the total blindness of me. You get it? So follow your medication. Use your medication as prescribed by your doctor. And you know, if at all you find yourself in my own shoe, there is still hope. There is ability in disability. That is my slogan. As long whatsoever you need to do in the high, at least I'm still functioning as a human being. I'm using other sets of organs to do all what I need to do as a human being. You get it? That is my own objection, suggestion and advice for everyone. Thank you.
Okay. 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 Are you done?
Hello.
Yeah. Are you done, Fumi?
Hello.
Hello, Fumi. Are you done?
Hello. Yeah, we can hear you.
Hello.
Are you done?
We are hearing you.
Okay. All right. I think she's done, actually. She said there's ability in disability, but blindness is more expensive than even the drugs that you have to buy. So those who have glaucoma should take note of that. So we then continue. So why? So you'll agree with me that there is indeed a reason for us to unite to have a glaucoma-free world. We have to unite to eliminate glaucoma blindness. Now, these facts are established with regards to glaucoma. The fact that it's an incurable disease is a lifelong disease and disproportionately affects Black people, and it follows an aggressive clinical course. You see the story of Fumi. She's completely blind in both eyes. She went blind from glaucoma, and it progresses despite adequate control of pressure. And the reason, one, awareness is quite poor. See the figure I gave. Only 1 in 5 people people suffering from glaucoma know about glaucoma. Even access to care. A lot of people do not even know where to go, to get their eyes checked. And there's the issue of late presentation, simply because we don't have that habit of getting our eyes checked from time to time, particularly as we are getting older. These are all the reasons. And also, risk of dying in people who have glaucoma, if care is not taken, is 4 times higher in blind Africans than in other individuals, Caucasians. And the causes of blindness, the blindness in glaucoma is 15-fold in people, in Hispanics, in Caucasian. It causes blindness more in Blacks. And there's increased prevalence as we grow older. And now we are all growing older into 80s, into 90s. So everybody is at risk of glaucoma. Nobody is immune, but we can prevent our going blind from glaucoma. So these are the various challenges: the limited access, late presentation, lack of appropriate medication, poor awareness, and inability to afford the medication, and aging. These are all the problems that we have in Nigeria, even in Africa. So what are the strategies? How can we unite to get glaucoma out of our world? Number one is we have to collaborate. Collaboration of all stakeholders. Who are the stakeholders? All of us, because we are all Africans. We are all praying to grow old, so we are collaborators in it. And the healthcare practitioners, the ophthalmologists, the optometrists, the opticians dispensing, and then we have the ophthalmic nurses, and even the patients, glaucoma patients themselves. We are all stakeholders. We all have to work together. Family members of glaucoma patients, and all of us, because we are growing older. And then we have to do have some innovations, be creative about our screening system or the technology, make use of technology, and also integrate healthcare at all levels of care. A lot of people do not even want to come to the teaching hospital. Some people would not even go to general hospital. Some people, you have to beg them before they even go to primary health center. So we need to take the care to the community, meaning we must have a patient-centered glaucoma care in our nation for us to be able to have a glaucoma-free world. And the principle to adopt is nobody should be left behind. This is SDG 2015, I think is number 3. Everybody should have we should have aim for equality and equity-based care. And these are the key elements. Make it accessible to everyone, let it be comprehensive, and decentralize it. Let's not stay at the teaching hospital. Let's integrate to primary care. Let the teaching hospital be supervising, or the general hospital be supervising what is going on at the health centers. Let's go into the community. Subspecialist care will be accessed through integration, and it then becomes affordable for those who are not able to pay for the care at the teaching hospital or even at the private hospital. Then we have equity of care, making whatever is needed. So I've talked about integration of care, take the care to the community, rural community. We can also make use of the social media, the telephone we have. Almost 90 to 95% of Nigerians have telephone, and a lot of them have the smart telephone. And with smart telephone, you can increase the diagnostic skills. You send people to those who are not even doctors. So we have what is called task shifting. Train community health workers to discover or to diagnose this disease, to examine people, place charts at village centers, or we can even have what is called vision hubs. We will put equipment there, train people at secondary school level. People can walk in there to get their eyes examined. From what I said, that except you go to look for it, you may not know that you have glaucoma. Did you hear Funlola's story? She said she did not know until very late stage because she thought she was still seeing very well. And at the time she was told, she thought the drugs were not even helping, and she stopped. Of course, what happened was the blindness at the end of the day. So we need to encourage ownership of care through domestic, employ people, involve them, let people own their care. These are the things we should be doing. And government, these are all the equipments. Family care is quite equipment intensive, and these are very, very expensive. But government can help, well-meaning people can help, individuals and industries can help. They put this at different centers and people just walk in there. It's not manned by an ophthalmologist, maybe school cert holders. You just teach them how to operate the equipment, and the results are then sent to a center where they are interpreted, and those who have glaucoma will be invited to come for further assessment. And also, we advise those who have family members to bring their family members for screening. And we also do screening. Like during this period of World Glaucoma Week, there are a lot of screening taking place, people going to marketplaces, people going to village square, going to churches to examine people's eyes, to screen for glaucoma, particularly those who are above 40, particularly those who have family members who suffer from glaucoma, because these are high-risk individuals and people who are elderly. The moment you are above 40, you are at risk. So you must get your eyes examined. If doctors don't come to you for screening, you go to the hospital, go to eye clinics to get your eyes checked out. Ask them, do I have glaucoma or not? And it is not just your pressure that should be checked. The inside of the eye needs to be examined, because 50% of those who have glaucoma, their pressures are within the normal range. So it's not enough for you to say the pressure inside my eye is normal. You may still have glaucoma, particularly if you have high blood pressure or your blood pressure is even very low. So these are all the reasons. And then Igbo and ethnic groups, please, let's take it serious. And those who are deprived, these are the people that are at higher risk. Family involvement, we need to educate our family members. Every glaucoma patient should ensure that all their family members get checked for glaucoma. That's the only way we can increase, or pick up people who suffer from glaucoma at the very early stage. Because when they are picked up at the very early stage and treatment is instituted, then we can prevent or slow down the rates of progression to blindness. Maybe instead of it being 10 years, we can lengthen it to about 40, 50 years. So if that individual was 40, it means that he may not go blind in a lifetime. And that is our aim. We also need to educate patients, family, and engage counselors. We have counselors in the hospitals who will advise patients to, accept whatever treatment modality has been offered. Like I said, the rate of surgical intervention is very low because patients do not want to have surgery. And because the drugs are so expensive, that seems to be the primary therapy for us in this environment, so that we can lower that pressure. Then other medical conditions, will also then be optimized. And then there's also the issue of training our staff, training our doctors, so that they can offer surgical intervention, that would even make the patient to see better for a long period of time, that the patient will not go blind in their active years. And there's also the issue of research. We need to do a lot of research. We don't know why it is worse in Black. It's quite aggressive. A lot of researches are being done currently, and we are getting results. There are genetic researches that are being done in Nigeria in various centers. And I'm sure in the next 10 years, we would have answers as to why some people have glaucoma and why some people do not have glaucoma. And this is health education. These are activities that we have going on this week. We have a lot of lectures. We have a lot of screening taking place, particularly amongst the family members and those who are above 40. We have people going to marketplaces so that we can reduce the number of people who are needlessly going blind from glaucoma. And we also provide pamphlets, educational pamphlets that people can read and ask questions. We are also using the social media to spread the information. What about patients who already have the disease? Of course, it's important for them to comply with treatment. It's because Alaja Otule, the first patient, complied with her treatment. That's why she has not lost useful vision as we speak. And it's almost 20 years that she's been on treatment, and acceptance, which she emphasized. And it's important that we have a good understanding and knowledge of glaucoma, that despite treatment, you would notice that things has not changed. But that does not mean you should discontinue treatment. You still have to forge ahead, and your family members must be checked, and you must go for screening, for follow-up regularly. Don't miss your appointment. But in addition, apart from using the eye drops, because of the other predisposition, eating healthy diet, green vegetables, the fruits, colored fruits would help. Green vegetables have been proven because of the nitrites in them. Spinach, any green vegetable is good for you. Exercise, exercise, exercise. Even walking, you don't have to run. Just walk will help because it will lower the pressure in the eye, and that will help. Weight control. You remember, obesity is one of those things that could predispose one or even make the disease worse. So we have to ensure that we stay within the right BMI. You know, we should not be overweight, neither should we be obese. So weight control, control what you eat controlled portion, eat a lot of vegetable, reduce the carbs, you know, and other medical condition. Of course, you have to take care of them. If you're on treatment for high blood pressure, hypertension, diabetes, make sure that you're doing well. But lifestyle changes is of utmost importance. Reduce stress, reduce stress. Reduce stress. Somebody will say, how can we reduce stress in Lagos? You can if you want to, and don't kill yourself. And we also then have to join forces with other stakeholders, the pharmaceutical companies who are selling these drops, to ensure that we have the genuine ones, and for them to also provide the combination drugs where you have 2 eye drops in 1 bottle, because that regimen of having to use this one 3 times a day, that one 2 times a day, that one at night, sometimes could be tiring, and it affects compliance in patients. So we are advocating that they fix those combinations to enhance adherence so that patients will use their drops, and also to supply generics. These are cheaper. You know, unlike the brands, which are quite expensive. Generic also will reduce the pressure so that patients will be able to afford these eye drops. And it's also important that the pharmaceutical companies begin to manufacture this anti-glaucoma medication locally. You know, then it will come cheaper. Instead of patients expending almost 50,000 per month. And remember, it is this same group of patients who have glaucoma, because majority of them are above 40. They have high blood pressure to contend with. They have diabetes to contend with. And that is apart from taking care of their homes, taking care of themselves. So how many people can dole out 50,000 on glaucoma medication? So it's important that we look at all these various ways in offering rebates to these patients so that they get their drugs readily. And of course, newer medication that also will help in reducing the rate of progression to disease. And we are also imploring the government, health insurance, to spread it to the informal sector. It's more informal sector. 90% of health insurance is being enjoyed by those informal sector. In informal sector, the woman selling on the street, we know that Lagos State is trying to engage people, everyone, on health insurance, because through the health insurance can cover some of the costs for this medication. And also important to establish optical workshop, because those who have advanced disease, they require low visual aids, magnifiers, and some of them, you know, needs to be rehabilitated the same way that Fumi was rehabilitated. And she's living her life now. I mean, thankfully, she stayed on, and we encouraged her. And I thank God that she's where she is today. And advocacy for public-private partnership, you know, to industries, to governments, those who can supply this equipment so that we can place them at various places and people can go in there to get their eyes examined, check. For instance, those who do not want to go to the hospital, some people just don't want to go to the hospital. And we are also talking to the government, federal government, state government, you know, to offer rebates on drugs, custom duties to be reduced on those drugs that are imported so that our patients will be able to afford them. So we are talking about prevention of progression to blindness. And this is only through early detection, when this disease is detected at the very early stage. And this can only be detected when you go in to get your eyes examined, regular screening, and sometimes primary eye care providers, community eye health workers can do this in the villages. Regular eye examination for everyone. By the time you are 35, you should see an eye doctor. Who should you see? An ophthalmologist, an optometrist. These two people will examine your eyes. They will examine the inside of your eye. It's not just those selling on the streets, not that you should go to the hawkers to buy glasses. You see some people, they just pick up the glasses, they put it on their eyes. Oh, I can read now. At that time that you are finding it difficult to read, it is not glaucoma. That is just due to aging changes. But seize that opportunity to see an eye doctor who will examine the inside of your eye, see the ophthalmologist. An ophthalmologist is the medical doctor who trained further in the care of the eye. These are the people that will treat you for glaucoma. They will do surgery for glaucoma, or they will do laser for glaucoma. Now, the optometrist, these are also eye care practitioner. You know, they test your eyes. If you require glasses, they give you the glasses. And if you have glaucoma, it's at advanced stage and you are not seeing well enough, they can give you low visual aids, magnifiers. You know, they teach you how you can move around. They tell you how to change the environment in your home, have better lighting, very bright light inside your house. Make sure you don't stay out too late. Go to where you have bright lights so that you don't trip. Because studies have shown that glaucoma patients with poor vision, they tend to have a lot of fractures because they fall easily. So if you have glaucoma, make sure the lighting in your home is very bright and have colors, bright colors, to distinguish maybe the steps so that you don't trip on the staircase. So regular eye examination every 2 years in those who are at risk. That is, you have a family member, it should be once a year if there's a family member suffering from glaucoma. But if there's no family member, make sure that every 2 years you get your eyes examined and you are given a clean bill. Your eye pressure will be examined and the inside of your eye will be examined. And for those who are on treatment, compliance and adherence to treatment is of utmost importance. Otherwise, you may fall into those group of 27% who lose vision in one eye, or even the 10% who lose vision in both eyes, even though they are using their medication. There are people who are even using the medication timely and they still lose vision. So lifestyle and dietary modification also would help us. So all of us uniting, the rallying point for stakeholders. Now, Glaucoma Society of Nigeria, we have gone ahead. We now have guidelines and toolkits for glaucoma management. This is designed for all stakeholders, all eye care practitioners, ophthalmologists, optometrists, opticians, ophthalmic nurses, you know, in the care of glaucoma. And it tells us the preferred practice pattern, which is based on what obtains in our environment. And so the take home today is that glaucoma impacts everyone indiscriminately. Indiscriminately is the word. And everybody is at risk of glaucoma. Nobody is immune. So by regular eye examination and compliance with treatment, we are able to reduce the risk of progression to blindness, because you cannot prevent getting glaucoma. So I thank you all for listening. Now I'm going to invite the ophthalmic nurse, Matron Otusoya, to just speak for 5 minutes, 10 minutes, as a stakeholder. She's an ophthalmic nurse. And then after her, would have the optometrist who will tell us the role he plays in glaucoma care, how we are all uniting to have a glaucoma-free world. Thank you.
Thank you, Prof.
Unmute her. So I start sharing now.
Matron Otisonya, please submit yourself.
Good afternoon, everyone.
Good afternoon.
Well done, Prof. Thank you for a job well done, ma. The lecture was well taken. My name is Fasonya Helen Murenike.
Sorry, Fasonya.
Yes, ma. As an ophthalmic nurse, when our patients come, people living with glaucoma, and those that are coming for the first time to the clinic, what we do with them is to receive them warmly into the clinic, to educate them, talk about all the causes, what glaucoma is, the predisposing factor, the likely signs to be watched out for, like Prof has rightly said, all those, everything attains glaucoma, so that I will not be repeating what Prof has said. So after receiving them, we get them prepared for doctors to see. We start by checking their VA, doing intraocular checking their intraocular pressure, and at the same time we do their BP check and their pulse. We can assess them to make the clinic flow well because of the training we have received. If we look at them, those that are coming for the follow-up, we see that they are doing well, their pressure is well maintained within their last visit to the clinic, and we know that it's just for refilling of drugs that they came for. Just make them to see the doctor, to just go through their folder and assess them and write their prescription for them to refill their drugs. And if it's those that are coming for the first time, go ahead, do all the glaucoma screening for them. Right, as far as doing the OCT and the CVF to check how far they have gone with their vision. And that all those we gather together to give to the doctor, so that the ophthalmic doctor, the consultant, can check them and screen them further. We don't diagnose in our own aspects, but we maintain a cordial nurse-patient relationship with them, discuss with them about their health and how their compliance with their drugs. We go as far as teaching them how to instill their eye drops and to observe their personal hygiene and how to keep their drugs, those that are supposed to be at the sleeve of the fridge, those that can see that are not are preservative free. They discuss with us, we mingle with them, and we give them moral support, because it's not we know that it's not easy to live with find their ways. If we make things easy at the clinic for them, that's majorly what the nurses do. And we stress to them that their compliance to their drugs, their eye drop, eating healthy, emphasize on the importance of follow up, and to bring their family for checkup. Each time at the clinic, we stress that, we make them know they need to be their family, their relations for checkup, and to discuss it with their relations. Some of the elderly that are the glaucoma, living with glaucoma, cannot instill their eye drop themselves. We advise them to bring their children. We talk to them, and those that are not bring their children, then we send them home to tell them how they maintain hygiene, and help them in the installation of their eye drops. And then we explain further the surgery aspects, the laser aspects, just allay their fear, because it's fear that makes some of them reject surgery, and they make them not to go for further treatment. Some of them that even need the laser will not want to go because of the fear, or because of what they hear about the surgery that is done in the eye. So we talk to them. Our work majorly is health education that we do mostly. and the preparation of them for consultants to see. Thank you.
Thank you very much, Matron Fasanya. So we then go on to the optometrist, the chief optometrist at Luth, Dr. Eniola. Please, the floor is yours. Dr. Eniola, please tell us.
Yes, good afternoon, everybody.
And
my prof. So I'm Dr. Eniola Abayomi Felix, the chief optometrist, Lagos University Teaching Hospital. As we confronted the escalating prevalence of glaucoma, it is a duty to contemplate an actionable strategy to tackle this issue effectively and empower patients to advocate for themselves. Collaborating with fellow eye care providers is paramount to ensure comprehensive care for glaucoma patients. The Nigerian Optometry Association advocates for a patient-centric approach in glaucoma treatment, emphasizing the imperative for optometry and ophthalmology to collaborate seamlessly. I employ each one of us to introspect on the impact we can individually feel within our state, chapter, district, and community, and unite during the Glaucoma Awareness Week to effective the necessary change. Optometry play a pivotal role in early glaucoma detection through validatory innovative screening method delineated in the National Guideline for glaucoma management. This was dedicated to fervent endeavor aimed at supporting community eye health promotion and facilitate efficacy referral, thereby envisioning a future where every Nigerian enjoys optimal vision. In conclusion, the Nigerian Optometry Association urged all the state chapter to form state glaucoma association or integrate with the existing glaucoma association in the state as way to combine effort to make patients take center stage in this all important fight against invisible glaucoma. In anticipation of your commendable advocacy endeavor, the Nigerian Optometric Association or optometrists extend its profound appreciation to each one of you. Thank you, and God bless you all for uniting for glaucoma.
Thank you. Thank you very much, Dr. Felix Eniola, for that speech. Yes, we have to unite to tackle glaucoma so that we can have a glaucoma-free world, and that is our aim. Now the lecture is over. We've had our speakers. I'm sure we'll have one or two questions. I have seen questions. Dr. Alabi? Dr. Alabi, the questions?
Yes, ma.
That we have, yes. So please, over to you.
Yes, ma. Thank you very much, ma. Thank you, everybody. So I'm going through the chat box to get out the questions that we have. Somebody is asking about imported and local drugs, wanting to find out if there is a huge difference in quality as to affect how glaucoma patients are managed. The quality of local and imported drugs, are there differences? Then furthermore, somebody wants to know how they can get the presentation and also have access to the Nigerian glaucoma toolkit and guideline.
So is it a
There's a question here for the matron. That's matron.
Dr. Alabi.
Can you mute?
Yes, sir.
Yeah, please. Can you just let Professor Onokoya take the questions one at a time?
Okay.
So that you, yes.
Okay, so the first one is somebody who wants the presentation. I think I've seen the person. Yes, I will send it to the person. I saw that person. I'll send
the glaucoma toolkit, ma'am.
The glaucoma toolkit is available online. I think there's a soft copy of the glaucoma toolkit, Nigerian guideline. It's available online. It's available online. It can be downloaded. Then, what's the other question?
The wide difference between local and imported drugs.
Yes,
does it affect the quality?
That's a difficult question to answer. You know, some of the locally made anti-glaucoma drugs are not many, I tell you. But I can tell you that those drugs lower the pressure. Now, imported may come from India, may come from UK, may come from US. You know, it does not necessarily mean that they would work better than what we have here, except we do a one-on-one comparison. That is when we can tell you that this works better. But we know that the brands, those are the original ones, not that the others are fake, they are generics. You know, we know that the brands, which are the original active ingredients, sometimes some of them, the rate of intraocular pressure lowering is more, maybe by 1 millimeter or 2 millimeters than the generics. Now, for somebody who is unable to, like I tell you, like one of them is about 20,000 for the brand. Now the generic is maybe about 7,000, but it will still lower the pressure. It may not lower it 1 millimeter to 1 millimeter as you have with the brand. But at the same time, there are also some that probably are not good, but it's difficult to know because there are so many ways that drugs are coming into Nigeria. Some of them don't pass through NAFDAC. So that's the challenge that we have. So I'll advise that you buy from a reputable pharmacy, hospital pharmacy.
And Prof, if I could just put in a word too.
Yes.
I think, you know, in as much as we are unable to really say categorically, you know, that one, you know, does not work as much as the other one. I think what's most important, especially in this economy, is that, you know, when these drugs are prescribed in the hospitals, they can usually buy them. But
yes,
the more they go for the more they attend their clinics for follow-up, you know, the more at least the doctors will be able to know whether what they are on is working appropriately or not.
Yes.
You know, because if you have a difference of 20,000, 25,000, you can agree with me that that's definitely significant. So, and we have so many of these generics, and so it's important that when they are given in the hospital, they use them, but at least they make sure they also go for their follow-ups, and the doctors will be able to pick that up if there is any problem.
Yeah, thank you.
Yes, ma'am. We have a question for Matron Fasonya here. Somebody wants to know the meaning of OCT, and the person wrote CVN, but I want to believe that is CVF. That what is the meaning of those abbreviations? Matron Fasonya.
Thank you, sir. OCT is a optical coherence tomography. It's a test done to assess the optical nerves. It's like a scan. It's non-invasive. It's non-invasive imaging examination done in the eye. I hope I've answered the person's question. The person wants me to talk more about the...
Then CVF. CVF.
a vision field is a test carried out. It's non-invasive to determine the vision left in the eye, both peripheral and the central vision.
Thank
Okay,
you.
these are tests that we do to follow up our
We do
patients.
to
It helps
follow,
us
yes.
to know whether we're doing well or not. And sometimes
Yes.
we need to change the treatment when we do this test. So it's important that patient goes for follow-up.
Thank you, Prof. And it's important to also mention that CVF is central visual field.
Visual
yes.
field, yes.
Yes. Then somebody has shared the link for the glaucoma guideline and the toolkit on the chat box, so they can check them.
Yes, so that's why I said it's available online. Yeah, the person said he found the link. So if you go online, you see glaucoma guideline and toolkit. Yes. So I want to, I believe that we have all learned something, but if you're not going away with anything, just know that regular eye examination is of utmost importance. Just as you service your cars, you service your vehicles, service your eyes by going to see the eye doctor to get your eyes examined. Don't wait until when you are not seeing. Even when you are seeing, go and see your eye doctor. You may be harboring glaucoma, and the earlier it is detected, the better for you, that you would not go blind. A lot of people, 80% of our patients, by the time they come, even when they are still seeing, supposedly, they have lost useful fields, and they are usually very surprised. Late presentation is still a lot. We did a screening today in our hospital. You will be amazed at the number of people that we picked. For every 10, you will see about 4 or 5 people who have glaucoma. So make sure that beginning from tomorrow, you get your eyes examined. And if you have glaucoma, take your family members along with you. Let them be examined. Take your children with you so that we can have a glaucoma-free world. I thank you all for your cooperation, for staying with us.
Prof.
Thank you.
Prof.
Yes.
There's a new question. I don't know if we have the time for you to take the question.
Okay. Is it I believe the optometrist?
Yes, that's a final question.
Yes, when a patient is visiting, yes. Why then is it that most hospitals, the optometrist is not the first to attend to a patient, especially in government? How can we? Yes. Well, the problem is because of people knowing boundaries. It's actually a tough protection, really. But we would get there. That's why we took that first step of the guideline that everybody can work with. So you know your limits. I mean, how many ophthalmologists are there in Nigeria? Maybe 400. We are not adequate. And of the 400, 90 to 95% of us are in the urban center with no one in the rural area. But we have like times 10 of optometrists. And the optometrists are able to go to the primary care center. I agree. The optometrist should be the first point of call. In fact, in developed countries, it's the optometrist that you see first. They examine you, and if there's glaucoma suspicion, then they pass you on to the ophthalmologist. In a lot of our private hospitals, it's the optometrist that is the first set, because those ones, they know their boundaries. What we are trying to prevent is situations whereby the optometrist sees the patients. Sometimes some of them made the diagnosis, but they continue to treat the patients. And by the time they come to the ophthalmologist, the damage is far gone. That's why in teaching hospital, the patients come to the doctors first, but readjustments will be made in the future, when we get everything right. And we'll go, it will be like, those will be the primary eye care providers. They see them. If there is nothing, they go away. If there is need for them to see the ophthalmologist, then they see the ophthalmologist. I tell you, in a country like the UK, the optometrist and the nurses, they are the ones who do the follow-up. Just by looking at the OCT, they look at the visual field. If it's stable, patient visual acuity is normal, the intraocular pressure is normal, the patient does not have to go on to see the ophthalmologist. And we will get there in this country. We are trying to rearrange things so that we'll have a proper care pathway for our patients. You go to see this person first. From there, you can see the other person. Thank you very much for the question. We'll get there.
Thank you so much, Professor Onokoya, and all the presenters. Once again, I'll hand over to Dr. Alabi to please do the closing remarks.
Thank you very much, sir. Our able chairman, Dr. Olayinka Shuneye-Von. My role is to appreciate everybody that have taken time out to be part of this webinar, Uniting for a Glaucoma-Free World. Everybody has a role. I'm going to start by appreciating all the discussants that have graciously, given their time to join us and to share their experiences with us. I want to especially appreciate Alaja Falilat Utule. I thank you, ma'am. Alaja Akala, we thank you greatly, ma'am. We thank you, Mrs. Omilola Damola. Thank you for your courage. Thank you for taking time out to share your experience. And you made some very valid points. Just like Prof also reiterated, you told us that blindness is more expensive than medication. And you also told us that even when there is blindness, there is ability in disability. We thank you for taking time out to share your experience, and we wish you all the best. I want to thank especially Dr. Felix Eniola, the optometrist, and also Matron Fasonya for sharing their experience and joining us for this webinar. And I want to thank our dear doyen of glaucoma. We want to appreciate you, Professor Adeola Onokoya. Ma, we cannot thank you enough for all you do passionately in leading the fight against this scourge called glaucoma. May the good Lord reward you abundantly. We thank you, ma'am, for everything you have shared. Thank you for your depth of knowledge in the field of glaucoma. And we are looking up to you, and we believe that we are all going to win this fight against glaucoma. I also want to thank all attendees, all participants, all patients, all friends, all relatives, all health practitioners, all colleagues, doctors, and most importantly, I want to thank fellow ophthalmologists. And we have some of our very, very, very senior colleagues, some of our teachers and mentors that have joined us in this webinar. We appreciate you all. I want to also appreciate those that organize this webinar, the members, the executive members of the Ophthalmological Society of Nigeria, Lagos chapter. Like I said, ably led by Dr. Olayinka Shuneye-Von. We thank you for organizing this webinar. And we can see that there is, progress in unity. No wonder the theme for this year's Glaucoma Week, Uniting for a Glaucoma-Free World. Everybody has a role. And we appreciate everybody that's taken time out to attend this webinar. And we pray that the good Lord will bless all of us and will give us the energy, the wisdom, the courage to win the battle against glaucoma. I thank you all for coming, and I wish us all a wonderful evening. Thank you all for coming.
Thank you.
Thank you very much. Thank you.
Thank
you. Well done.
Members of Glaucoma Patient Care Initiative. This is a group. So if you have glaucoma, please join that group.
Thank you.
Mrs. Otule. Thank you. Thank you also very much. God bless. We will all be alive here to witness another one.
Prof, we enjoy
Thank
your
you,
lecture.
We appreciate you.
Thank you, my people from Israel Assembly. We appreciate
We
it.
enjoy your lecture, man.
Thank you, my people from Israel Assembly. Thank you very much for this.
Thank you, my people from.
You serve it.
Thank you. Thank you. Bye.
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 Everybody.
Bye.
Hello,
Hello, ma. Bye.
Hello. Bye.
bye-bye, everybody. Thank you.
Thank you,
Yes,
Prof.
thank you. Thank you very much.
I'm deeply sorry. It was my internet that is not okay, ma.
For me, yes. I know.
But am I
But
able
you
to say
did well.
something?
We had you well.
Okay.
You did very well. Thank you very much for me once again.
You're welcome, ma. You're welcome, ma. Bye, ma.
Thank you very much, ma Prof, for bringing everybody together in the fight against glaucoma.
Thank you.
Thank you so much,
We
ma.
have to unite. We have to be united
Yes,
for us
ma.
to fight glaucoma. That's the only way we can beat the invisible glaucoma.
Glaucoma.
Yeah, that's it.
Thank you so much, ma. Yes,
All
ma.
right. Thank you.
Prof.
Yes, ma.
I'm seeing you on more.
Oh, okay. Who is speaking? I can't hear the person again. No. Okay, thank you also very much. God bless. Okay, from Abeokuta, God bless. Thank you. M1 Lagos, thank you. M1, okay. Thank you. Thank you. Okay.
Prof, thank you.
Thank you very much, my chairman. Okay.
Yes, sir.
All right. Thank you.
Thank you, man.
Thank
Thank you, Chairman.
Well.
Alabi,
Okay.
thanks so much.
Bye.
Bye, man.
So Yinka will talk, eh?
Yes, ma'am.